Hello and welcome back to our lecture series on Sarcopenia Assessment. In this series, we will explore various methods and tools used to assess sarcopenia, a condition characterized by loss of muscle mass and function. So let's get started. So in this presentation, we will cover the following topics: the AWGS and AWGS algorithm, SAC-F questionnaire, calf circumference, SAC-CAF, UB-WACA test, muscle mass assessment, muscle strength assessment, physical function assessment. Each of these components plays a critical role in diagnosing and managing sarcopenia. By the end of this lecture series, you should be able to conduct this assessment yourself. So first, let's discuss the algorithm developed by the Asian Working Group for Sarcopenia, or AWGS, and the European Working Group on Sarcopenia in Older People, or EWGSOP. These algorithms provide guidelines for the diagnosis of sarcopenia. The AWGS 2019 algorithm includes criteria for low muscle mass, low muscle strength, and poor physical performance. Similarly, the EWGSOP2 2019 algorithm includes criteria for low muscle strength, low muscle quantity or quality, and low physical performance. These algorithms help clinicians systematically identify and diagnose sarcopenia in older adults. So, the SAC-F questionnaire is a rapid diagnosis or diagnostic tool for sarcopenia. Here is how you can administer it. It actually has 5 items. Item number 1, strength. Ask the patient how much difficulty they have in lifting or carrying 10 pounds. Item number 2, assistant with walking. Ask about their level of difficulty walking across a room. Item number 3, rise from a chair. Ask about the difficulty in getting up from a chair. Item number 4, climb stairs. Ask about their difficulty climbing a flight of 10 stairs. And item number 5, about falls. Ask how many times they have fallen in the past year. Each component is scored from 0 to 2, with a total score ranging from 0 to 10. A score of 4 or higher suggests sarcopenia. This questionnaire is user-friendly and takes about 5 minutes to complete. Calf circumference. Calf circumference can be used as a diagnostic proxy for sarcopenia. Here is how you can measure it. You need a non-elastic tape measure, and then have the patient stand with their weight evenly distributed on both feet, or they can sit down. Measure the maximum circumference of the calf at its widest point. Make sure the tape measure is snug but not compressing the skin. Record the measurement for both calves and use the larger of the two measurements. The cutoff points are: for men is less than 34 cm, for women is less than 33 cm, to probably diagnose them as having the possibility for sarcopenia. This method is particularly useful in settings where other diagnostic tools are not available. Another diagnostic tool is using the SAC-CAF. The SAC-CAF combines the SUC-F questionnaire with calf circumference measurements. Here is how you can calculate the SUC-Calf score. You have to first complete the SUC-F questionnaire and then measure the calf circumference as described in the previous slide. Scoring for calf circumference, 0 points for absence of low muscle mass when man shows more or equal to 34 centimeter and women about 33 cm and above. So now you have to total the SUC-Calf score. Add the SUC-F score to the calf circumference score. A total score of 11 or higher indicates sarcopenia. This combined method improves the diagnostic accuracy compared to using either tool alone. Now, you can try the finger ring test or AWGS. This test you can teach your client to do themselves so that they can monitor the presence of sarcopenia from time to time. The finger ring test or AWGS is a self-reported method to screen for sarcopenia. So here is how you can perform it. The procedure. Use the index fingers and thumb of both hands to encircle the thickest part of the non-dominant calf. Ensure that the fingers are placed snugly around the calf without overlapping or leaving gaps. How do you interpret? If the calf fits exactly or is smaller than the encircled fingers, this suggests an increased risk for sarcopenia. This test is simple and does not require any equipment, making it accessible for self-assessment. Now, muscle strength can be assessed using hand grip strength and the chair stand test. Here is how you can perform this test. For the hand grip strength, you have to use a JAMA dynamometer or similar device. Ensure the patient is seated with their elbow at a 90-degree angle and their forearm resting on the table. Instruct the patient to squeeze the dynamometer as hard as possible for a few seconds or at least 2 seconds. Record the highest value from 3 attempts for each hand. The cutoff score, if it is less than 28 kg for men and less than 18 kg for women, it may indicate the presence of sarcopenia. Now, alternately, you can do the chair stand test. Use a standard chair with a straight back. Instruct the patient to sit in the middle of the chair with their back straight and feet flat on the floor. Ask the patient to cross their arms over their chest. Time how long it takes for the patient to stand up and sit down 5 times as quickly as possible. Alternately, count how many times the patient can stand and sit in 30 seconds. These tests provide a convenient measure of muscle strength and can be easily performed in a clinical setting. Now, assessment of muscle mass or quantity. Muscle mass can be assessed by adjusting the result for height or BMI. Here are the methods commonly used: the MRI, the computer tomography, and BIA. But for MRI and computer tomography, they are expensive and is not commonly used in the clinical setting except for research activities. So in the clinical setting, we can use the BIA to determine the muscle mass. BIA estimates muscle mass based on body electrical conductivity. It ensures the patient prior to conducting the BIA to test muscle mass, ensure that the patient is well hydrated, place the electrode on the patient's hand and foot. Okay, so this is the picture of the BIA that is commonly used in the clinical setting. Allow the device to measure the impedance and calculate the muscle mass. So for the BIA, we report the appendicular skeletal muscle index, and if the cutoff points are less than 7 kg per meter square in men and less than 5.7 kilogram per meter square in women, so they may have sarcopenia. Okay, and there is another method that normally is used either in research or in the hospital setting, that is using the dual energy X-ray absorptiometry. Okay, right. So each of these methods has its advantages and limitations, but they all provide valuable information on muscle mass. So now let's look at assessment of physical performances. Physical performance is defined as an objectively measured whole body functions related to the locomotion. Here are some recommended tests by the AWGS 2019. We can use the short physical performance battery that measures balance, gait speed, and lower body strength, with a cutoff of less than 9 indicates poor physical performance. Okay, so if any one of you would like to learn how to use the SPPB, please let me know by contacting me via email. Okay, or the tools that we commonly use, which is faster and easy, is the user gait speed. So the user gait speed measures the time taken to walk 6 meters at a normal pace from a moving start. So take the score, average at least 2 trials with a cutoff score of less or equal to 0.8 to less than 1 meter per second may indicate um, a person at a higher risk of severe sarcopenia. Alternately, we can use the 6-minute walk test that measure the distance walk in 6 minutes, or the stay climb power test that measures the time taken to climb a set number of stairs. Or we can also use the 5-time chest and test as surrogates for gait speed and leg muscle strength, with a cutoff of more than 12 indicates poor physical performance. So these tests provides a comprehensive assessment of physical performance and can help identify functional limitations. So in summary, we have discussed various tools and methods for assessing sarcopenia, including the AWGS and EWGSOP algorithm, SACEF questionnaire, calf circumference, SACA fingering test, muscle strength assessment, muscle mass measurement, and physical performance tests. Each of these tools provides valuable insights into the diagnosis and management of sarcopenia. Thank you for joining this lecture series on sarcopenia assessment. We hope you found the information useful and informative. If you have any questions or need further clarifications on any of the topics discussed, please feel free to reach out. Together, we can improve the diagnosis and management of sarcopenia to enhance the quality of life for older people. Thank you very much.